Day in operating rooms across this country, surgeons are patching up people who should never have ended up on that table. And if you could stand there for just 1 hour and watch what actually happens, you would never think about your health the same way again, because what brings most of those people into surgery is not some sudden random event. It is something that has been building quietly for years, sometimes decades, a process so slow and invisible that by the time it shows itself, it is already too late to reverse in that moment. And that process is atherosclerosis, the gradual buildup of plaque inside your arteries, the same arteries that are supposed to carry oxygen and nutrients to every organ in your body, including the two organs that matter most, your heart and your brain. And here is the part that should stop you cold. Cardiovascular disease is the #1 cause of death in every developed nation on Earth. Not cancer, not accident, not infections. Your blood vessels are what kill you most often. And the majority of people walking around right now have absolutely no idea what is happening inside their arteries at this exact moment, because the system is not designed to show you that early. It is designed to react when something goes wrong, not to prevent it from going wrong in the first place. And that is why you will almost never hear this explained clearly at a routine appointment, because there is no billing code for preventing a heart attack that never happens. But there is one for treating the one that already did. And that difference matters more than most people realize, because by the time you are sitting in an emergency room with chest pain, the process that caused it has already been unfolding for years. And that is why the 3 warning signs you need to understand right now are so critical. Because they are not vague, they are not subtle, they are specific patterns your body uses to tell you that something is wrong. And the first one is something many people dismiss far too easily. You are climbing stairs, maybe carrying groceries, maybe doing something slightly physically demanding, and suddenly you feel a tightness in your chest, a squeezing, a burning sensation. Something that was not there before. You stop, you rest, and within a minute or two it goes away, and you tell yourself it was just fatigue, maybe stress, maybe you are out of shape. But that pattern, pain with exertion that disappears with rest, is classic exertional angina. And it means your heart is not getting enough blood when it needs it most, because the arteries feeding it are narrowed, and that is not something you wait on. That is something you act on immediately, because that pain is not random. It is a signal that your heart is under stress. And the next time that demand increases, it may not resolve with rest. The second warning sign is even more dangerous, because it does not always feel dramatic. It can be subtle. A moment where your speech feels slightly off, where words do not come out clearly, where one side of your face feels weak, where your arm does not respond the way it should, and then a few minutes later everything returns to normal. And that return to normal is exactly why people ignore it. They think it passed. It was nothing. But that is what doctors call a transient ischemic attack, a thanks in advance. And it is not harmless. It is the warning shot before a stroke. It means blood flow to part of your brain was temporarily reduced. And the next time it happens, it may not reverse. The third sign shows up in your legs, and it is often dismissed as fatigue or aging. You walk a certain distance, maybe 200 or 300 meters, and your calves begin to burn, to cramp, to feel like you have pushed through an intense workout. You stop, you rest, the pain fades, and then you walk again. That pattern is called intermittent claudication, and it means the arteries supplying your legs are narrowed, limiting blood flow. And here is the statistic most people never hear. When that condition progresses to the point of amputation, the 5-year survival rate drops to around 10%. Not because of the surgery itself, but because of the systemic damage and the psychological and physical toll that follows. And that is why these symptoms are not optional. They are signals that demand action. Not panic, but immediate evaluation. Because understanding what is happening inside your arteries changes everything. And here is the first truth you need to accept. Atherosclerosis is universal. Every person who lives long enough will develop some degree of it. Pathologists who examine arteries after death almost never find a completely clean vessel in someone over 60. The difference is not whether plaque exists. It is how stable it is. Because stable plaque can sit quietly for years, but unstable plaque, inflamed plaque, is what causes heart attacks and strokes. And that is where the real danger lies. Not in the presence of plaque, but in its behavior, because when a plaque becomes inflamed, its outer layer weakens. And when it ruptures, your body responds as if there is an injury inside the vessel, sending clotting factors to seal it, forming a clot that can partially or completely block blood flow, and that is the moment when everything changes. That is when a heart attack happens. That is when a stroke happens. And the process that leads to that moment is not random. It is driven by a set of factors that you can actually influence, and the data is very clear on this. Smoking and high blood sugar account for the majority of severe cases. Smoking directly damages the inner lining of the arteries, the endothelium, making it vulnerable to plaque formation, while chronic high blood sugar, as seen in diabetes, alters proteins and tissues through glycation, creating a thick inflammatory environment that accelerates damage from the inside. And this is where one of the biggest misconceptions needs to be corrected. Cholesterol itself is not the primary villain. It is part of the repair process. It is sent to damaged areas to patch them. The real issue is what is causing the damage in the first place. Remove the damage, and the need for that repair response decreases, but when the damage continues day after day, year after year, the repair process becomes accumulation. And accumulation becomes plaque. And then you add another factor that most people underestimate. Blood pressure, chronic hypertension quietly reshapes your arteries, making them stiff, less elastic, more prone to injury. And when you combine that with excess body fat, which acts as an endocrine organ producing inflammatory signals, and chronic low-grade infections, even something as common as untreated dental issues, which can introduce bacteria into the bloodstream and contribute to plaque instability, you begin to see the full picture. This is not one cause. It is a network of factors interacting over time, and that is why the solution is not one pill or one change. It is a system. And this is where your previous understanding becomes critical. Because just as food sends signals that shape metabolism, it also sends signals that influence inflammation, blood vessel health, and plaque stability. The same gut microbiome that affects your weight also affects your vascular system. The same inflammatory processes that drive fat storage also destabilize plaque. And this is where everything connects, because when you improve your metabolic signals, you are not just changing your weight, you are changing the internal environment that determines whether plaque remains stable or becomes dangerous. And this is why movement is not optional, it is essential. Regular physical activity improves blood flow, enhances endothelial function, increases insulin sensitivity, and reduces inflammation. Even something as simple as consistent walking at a brisk pace can have measurable effects on cardiovascular risk, and when time is limited, short bursts of higher intensity activity can stimulate powerful responses in a fraction of the time. And then there is temperature exposure, something that has become popular recently but has deep physiological roots. Cold exposure forces your vessels to constrict and then dilate, improving their flexibility and responsiveness, essentially training your vascular system to function better. And nutrition plays an equally important role. Reducing refined sugars and processed foods lowers blood sugar spikes, decreases inflammation, and removes one of the primary drivers of vascular damage, while whole foods, especially those that support the microbiome, create a more stable internal environment. And stress, something many people ignore or normalize, has a direct impact on your cardiovascular system. Chronic stress elevates hormones that increase blood pressure, disrupt sleep, and maintain a constant state of low-grade inflammation. And over time, that becomes a silent contributor to disease. And this is why the concept of prevention matters so much, because by the time a major event occurs, the opportunity to prevent it has already passed. And this is why starting early, even before symptoms appear, is critical. Regular checkups, imaging when appropriate, understanding your numbers, building a relationship with a physician who follows your progress over time. These are not optional extras. They are part of a strategy that keeps you out of the operating room in the first place, because the goal is not to treat disease, it is to avoid it, and that requires awareness, consistency, and a willingness to act before something forces you to. And this is the part most people miss. They wait for a reason to change. But by the time that reason appears, the system is already under strain, and that is why the earlier you start sending the right signals, through food, movement, and lifestyle, the greater the impact over time. Because your body is always responding, always adapting, always moving in the direction of the signals it receives most often. And once you understand that, you realize that the outcome is not random. It is the result of patterns. Patterns that you can change. Not perfectly, not instantly, but consistently. And that consistency is what determines whether your arteries remain functional or become a problem. And that is why this matters. Because what happens inside your blood vessels today will determine what happens to your health years from now. And that is something you can influence starting right now, with the choices you make, the signals you send, and the patterns you repeat every single day.